That's going? Great. So this is an emergency transfer, a Labrador with potentially a gallbladder mucocele. The breed doesn't quite fit and the ultrasound picture doesn't quite fit either, so not exactly certain or 100% certain that's what we're going to find, but we'll see. They said the gallbladder was normal size.
Yeah,
and the liver looks normal apparently, so it's all...
This is from our ultrasound?
I don't... Someone else read it. Sage or something? Let's come over there. Thanks. Thanks again. So no bowel peritonitis. Yeah, the report's a little bit weird because it said normal sized gallbladder or not distended. Maybe it's ruptured, but they didn't report any fluid in the abdomen, or
yeah,
a small amount cranially, but. Almost there.
Who wasn't convincing why we jumped to surgery?
Because there's a gallbladder abnormality. So I kind of framed it more as an explorer and see what's going on. The liver also apparently looked normal, which is... Oh, thanks. Let's come up a bit more.
Yeah.
Why don't we try that? Thanks.
I did not know.
What's that?
I did not know that that's what that was for.
Yeah. Oh, that liver doesn't quite look normal there.
That lobe was modeled right there.
Yeah.
Looks small too.
Yeah, it
For a
does.
dog this size?
Yeah, it doesn't look like a gallbladder mucocele. As in,
Yeah, maybe he's got some. Maybe he's really small.
can we call in someone from IM?
He's got like chronic hepatitis or something.
Yeah, I don't know. I've got some bile-stained lymphatics.
Really dilated, huh?
Yeah. That portal vein looks pretty big.
What is the stomach shot?
I would have thought they'd see something on ultrasound, but the liver is small.
Very small. Very small.
Let's just start with the liver biopsy at least. Thanks.
Was left medial?
What's that?
Left medial?
Yeah, I think so, yeah.
Baby?
No.
Yeah.
It's
Liver's
very weird.
small.
So just let me do this and I can show you.
Is it?
It smells funny.
Smells funny?
Yeah. Yeah, the insides.
Maybe we just need to let the bad air out.
The gallbladder looks intact
The gallbladder's intact, yeah.
and normal.
Yeah.
Do you want that in formalin, or do you want like copper stuff too? Like, do you want to slice it up and do multiple?
The IM's coming, or someone from IM's coming, so we'll find out.
Is there still the same number of lobes?
Yeah, they're just small. Yeah, this one looks particularly weird. Oh, sorry, it was, yeah, that's the left lateral there.
It's tiny.
Um,
And can you express the gallbladder? Like it's
yeah, it's all fine.
The lymphatics are dilated, they're like bile-stained, but you can
Yeah.
see.
How strange.
So this is our left lateral liver lobe just here, which is very small and almost fibrotic in coloured. Our gallbladder is just in here. The gallbladder looks normal, it's not distended, it's expressible. Even this just looks weird. I'm not sure what liver lobe that is, but that might be the quadrate lobe, but it's just kind of hanging off a little fascial attachment there.
I'm here in lieu of IM because they're just finishing off a procedure.
Okay, so the liver looks weird. This is the left lateral lobe just here. Very small, pale. This is, I think, the quadrate lobe. So it's kind of hanging off like that. So the liver's quite small. Looks pretty weird. The
I don't know why I'm looking there. I just look on the screen.
yeah, well, the gallbladder is normal. There's some, it's expressible. There's no real issues with the gallbladder. The lymph, you can see here, the lymphatics are dilated, kind of bile stained. And there's, yeah, let me have a look at that. There's an enlarged lymph node there. The ultrasound is weird, and it said that it didn't actually mention the liver. It said the gallbladder was not distended, but it was mucously looking. So they postulated that it might have been a rupture, but there was no free fluid. And that was about it. Oh, they said that one of the kidneys was large.
And no, like, chronic history? No.
No.
It looks like it's an acute onset.
It was like a week ago, right? It started not feeling that great.
Yeah.
And this is one of.
It's just been, like, trucking along with its tiny liver until couldn't anymore. Maybe his first drink last week.
4, right? That's correct?
Yeah, and this is the portal vein, which to me, I don't spend much time looking at the portal vein, but it looks pretty big.
That's big, and like that area is a deep edematous. I
So-
think it's big because I've been looking at all of it because I do my little
The common bile duct looks normal. I can't.
quite small.
Okay.
So I don't feel like taking the gallbladder out. It's going to
Seems
do the
silly.
job.
Yeah. I agree.
I think
Um,
see what I am says, but I would guess they'd want to do like the full liver workup, like the
Yeah.
culture,
Biopsy, culture the
culture
bio.
biopsy, and then they send like fresh frozen samples
To
for
copper and-
Yeah.
Then go ask Emily. She was just finishing off. Like I said, I'd just check out what's going on, but I'll grab her.
They're usually pretty specific about like the number of samples they want, and sometimes they want from like multiple lobes as well.
It bled a fair bit even with the ligature.
The other thing you could do is just like obviously everything's open, but you could grab just the little the laparoscopic biopsy forceps because you do the like you twist it and it just kind of it's like a twist and tear, and they tend to not bleed a ton.
I usually don't expect bleeding with that,
Yeah.
so
It said like it would bleed,
And they're just
even though we use ligature.
I'm trying to think because I don't know if we have a 3.5 millimeter, but we have the like 5 millimeter. They're just so tiny, and you just twist them a bunch, and they don't tend to get too angry.
well, that's what I'm wondering. I don't know who did the ultrasound. It sounded like a radiologist read it, but I would have thought
Oh,
you'd.
was it here?
It says Sage, like when you.
Yeah,
Can you bring up?
radiologist.
Can you bring up the ultrasound report? It said, well, not the report per se, but
Is it with
it's not a report that's written out by a separate radiologist, but it says Sage something or other.
Is it worth getting a file aspirate as well?
So you can probably see better on the screen. So this is the left lateral lobe here, just to give you an idea of how small the liver is, or parts of the liver. So that's the left lateral lobe, probably actually just here, if you can see that.
Yeah.
The quadrate is just kind of hanging off like this. Overall, it seems smaller. The left side's smaller than the right side. The gallbladder itself it kind of looks like a normal gallbladder. There's definitely no evidence of rupture. The common bile duct looks normal. To me, the portal vein, as you can see here, kind of looks bigger than I'm normally
Okay.
used to. There's this one lymph node here that kind of looks larger than normal, and then the lymphatics are bile, kind of, they look dilated with bile discoloration.
Okay.
And we've taken one biopsy from the left medial liver lobe. It bled a bit more than I used to.
Okay. Well, I mean, I guess if we're here to not take out the gallbladder, but to take, like, to find out what's going on in the liver, we would need a few more biopsies if you're comfortable with it. But if you're not, then
Like, sure, I can take some more.
is there.
Yeah.
And we would want like bile culture and liver for culture.
What's the second one?
Bile culture with a piece of liver for culture.
Mm-hmm. In the same one, or?
Yeah, you can put them in the same thing.
Yeah.
And then the rest for biopsies and copper and all that.
So how many biopsies do you want?
Well, I mean, that's a big piece. Normally, like our last guy does the but 4 like, right? So maybe another little piece, and then we'll take a piece of that to save in our red top for fridge freezer. And then lymph nodes.
Yeah, we can grab the lymph node.
Or a copper.
Thanks, Kelly.
Top right. We're on the right. Underneath. Yeah. No, underneath, like in front of you. Eye level. Yeah, top right.
I'll look it up and any other suggestions like in that. Yeah, that's very good.
Yeah, did you? That one didn't bleed as much.
What's that?
That one didn't bleed as much.
No, but that was really abnormal left lateral. Let's take one more from here.
Yeah.
Thank you. Is there one? I have to do a slot too.
Yes, and do you want a 25 needle?
Oh, yeah, that's a bit. Is that too big or do you want another piece?
No, it's okay.
This big.
I know. Yeah, next time.
That's not a gallbladder mucocele.
And you went, but you were so like, you had three reactions, or like so aggressive. That makes sense. Yeah. Yeah, like just like kind of like learning it.
Anything else?
Think
I-
you got
I'll-
it all right?
Might just grab that lymph node as well. Just hold it up like so. You don't have to hold that, it's okay.
shit, I think Alice has red top too.
She
This
did
is
say-
like the one with the red.
Okay, cool.
Um,
Okay. Maybe do this.
okay, I'm like this.
Put that in there.
Okay, you want me to put it?
Yeah.
Oh, and that one. And the that one, okay.
Yeah. And these. You can hand it over to her and then see what to do. And then we'll get a couple of histojars as well. Do you want them all in one histojar or separate?
I would ask.
Together?
Yeah.
Are you leaving soon? Are you done? Are you leaving soon? Are you done?
I am done.
Yeah. You guys are gonna do Emily? Give Galley's number.
Yeah.
Do you want to text her, ask her if she wants separate jars for the history?
What is this?
For whatever biopsies, yeah.
I don't know, they told me to give it to you. What is it?
It's liver.
It's lymph node.
Is that hepatic or mesenteric?
No, it's. I would guess it's hepatic. It was just. Yeah, I guess it's hepatic. Okay, you can let that go.
Well, that's bio and liver.
Okay, just hold that there.
It might work. Look at those fast down. It's not like horrible, but it's not beautiful. Emily and Callie are just looking over the ultrasound again and will be in shortly.
Thank you.
Okay, we cut that. That's better. What's that?
Yes, but we're putting on the audience. Do you want separate containers for the liver or all together? Thank you.
And can we attach momentum to a liver in this sort of case and
Oh,
just
you-
give it a tag? So
It'll migrate there anyway. So, but yes, you can. But typically, I just let it migrate there.
Do you want surface up?
No, that's okay. A little bit more concerned about just continued bleeding in this dog than most dogs. Just- 'cause, 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 No, it's not quite coagulating great. The only liver lobe that actually did do what it normally does is the peeny weeny left lateral. Okay. While we're waiting, why don't we just give it a lavage? Just with warm water. Can we grab some warm saline, please?
Mel? Mel? Can you grab some warm saline, please?
Warm saline?
Warm.
A liter?
Yep. Thanks. We have the suction on as well, please. I don't think I've seen that tattoo completed before.
That's Ella on a Vespa.
Yeah, I don't remember that one.
I had it for 2 years.
I don't remember the Vespa at all. I remember the balloon, but I don't remember the Vespa.
Yeah.
Very cool. And you've got the other stitch material.
Yeah, guys, your PDS. Oh, no, we already got it.
What's that?
We already got it. Yeah.
That wasn't very exciting.
This dog has a travel history, maybe it's parasites.
It's got a travel history?
Yep.
Where to?
I think Alberta, Manitoba.
You can't go out. Can't go out west. Not to Alberta.
Okay, sounds good. Thanks.
Those cessationists.
Yeah.
Okay.
So we're looking at the ultrasound images and the history. You can't really tell from the ultrasound images, but there's like one picture of the gallbladder and you can't really tell, but she has, like, if you think the gallbladder looks normal, and she has no
It's-
like indication of inflammatory.
It's definitely normal. Like gallbladder mucus seals, I can't aspirate
Right,
bile from. So
yeah. So we were saying not remove the bladder and get a sample.
I'm in support of that. So I've got one from the really abnormal left lateral liver lobe, 2 from the other liver lobes, I think.
This is the first one.
I thought that would just go for biopsy. And then that's the lymph node that was.
Oh,
This one?
Yeah.
This is not lateral.
oh, okay.
Yeah. This one looks really weird.
Yeah, it does look like
That's the only one that didn't bleed. All the other ones bled.
Oh.
A fair bit, like more than I'd be used to.
Your PPECC was presumably normal. You didn't look at that.
Is what?
Your PPECC was normal.
I think
Huh.
one of the PC was elevated, not?
Anyway, we're good to close?
Yeah, so if the gallbladder is normal, we would assume it.
Okay.
Yeah. And basically there's no leukocytosis, she doesn't have a fever, there's nothing that would suggest she has like a infectious cause.
Yeah. Okay.
How would you like be separated for this film? Like, or does Danelli go the same?
They go together, so we just want like with the bile,
So we're just going to close up from here.
he's already a little bit.
It seems like he probably has primary liver disease. We're going to investigate that to see whether it's infectious, copper toxicity, or something else. A shunt doesn't really make sense. The small liver is, definitely a problem, but the portal vein looks far larger than I would have normally expected. So, is there any more bleeding or?
No, we double check. I think there is some.
That's just where it pulls. So. That's right, that's not bleeding. There's just a little rupture there, that's okay. That should stop.
You should give him erythromycin acid and this,
What's that?
erythromycin acid and all. You can give here.
No,
Just stop the bleeding,
no, just let it be.
or just the pressure for some time because of
I think it's a weird liver in that, this is enlarged, this portion's enlarged, this is enlarged, this portion of the quadrate's enlarged, but other parts are very small. And these ones it's almost like it's undergoing spontaneous bleeding. Okay, let's close up. Thanks, guys. That's not fun.
Not old one either, right? Like
4.5, yeah.